All right, well, thank you so much for this opportunity to come and speak with all of you today about a topic that is very near and dear to my heart, preschool-based intervention to improve the social communication of children with special needs. For today, in the interest of time, I'm going to focus this presentation on one developmental disability, and that is autism spectrum disorder. I recognize there might be varying degrees of familiarity with autism spectrum disorder, especially how it looks in younger children. So I want to spend just the beginning part of this presentation talking about what autism really looks like in young children and how it is so important to do intervention with young children on the spectrum. So very broadly speaking, autism spectrum disorder is a developmental disability that is characterized by very qualitative impairments in social communication and interaction, as well as the presence of restricted and repetitive patterns of behaviors, interests, and activities. And within these two very broad domains, there's a lot of specific ways in which these two core impairments manifest in young children. And individuals who are on the autism spectrum always have these types of impairments throughout their life, but the specific way in which they look changes as individuals age. When we're talking about young children, it's particularly important to do interventions that focus on social communication and social interaction. And as we'll talk about a little bit later, interventions for young children that are on the spectrum that really focus in on that skill of social communication, we know lead to better long-term growth and better long-term outcomes in young children who are on the spectrum. So when we're talking about younger children, social communication is just a really important outcome and skill to focus on for children who are on the spectrum. And very generally speaking, social communication as it regards young children who are on the spectrum and some ways in which it's uniquely impaired means the communication that's happening between a child and some other person, maybe it's a peer or another adult, and that communication is happening about something else, whether it be another object in the environment, some event that the two are mutually focusing on, or some common activity. And when kids are really young, there's a lot of ways in which this communication happens. Before children learn to speak, they use gestures or nonverbal communication. And children on the spectrum really show characteristic impairments in nonverbal communication. So nonverbal communication means things like pointing, giving, looking, eye contact, sometimes affect. And children who are on the spectrum, we know, really don't show weaknesses or any differences from other children who are typically developing or who have other developmental disabilities with respect to their ability to request. So for example, this child here is pointing to request that she wants something, so presumably there's a toy that's really interesting to her. But children on the spectrum really do show characteristic impairments in their ability to use gestures to convey interest. So there is a certain function of a communication that seems like it's particularly challenging for young children on the spectrum to exhibit. And this kind of deficit has been shown through numerous studies for a very long time to lead to impairments that are very characteristic of children on the spectrum. So language deficits, challenges with emotion regulation, challenges with peer relationships. So it's really important, as we'll talk about, to hone in on this kind of deficit in nonverbal communication. And then of course, once children become a little bit more fluent with nonverbal communication, just like other children, they'll start to develop verbal communication, or the ability really to talk as we think about with talking. And I'm going to show you a clip of one child who is on the autism spectrum, and you can see him exhibiting one kind of stereotypical way that younger children on the spectrum might talk. You can see him really talking about things that are highly, highly interesting to him. He's talking in one-word utterances, and also using gestures at the same time to point to things he's interested in. So in addition to really talking about things he's very interested in, and not necessarily things that the other people in the room are interested in, he's also requesting a lot. So the specific way in which he's using his verbal communication is just a little different than what we might think another child his age would do.
Oh, you're where? Yeah. Oh, very cute. More water?
So he's kind of directing her behavior.
There you go. You can have some. No. You don't want it? For me? I want it.
So interventions that focus on these types of impairments in really young children who are on the spectrum, so social communication impairments, we know have a lot of advantages for children. In the short term, there's a lot of evidence that the specific social communication skill that's the focus of the intervention can improve. There's a lot of different ways in which studies have tried to improve social communication in young children on the spectrum, and it seems like many different ways of teaching work, and that not only can a specific type of social communication skill improve, so something like nonverbal social communication or verbal social communication, but also related skills can improve, so things like language, emotion regulation, other things that are really important. So it's not just like we're getting a benefit from working on this specific social communication skill, but also other related skills. Also long-term, what's really exciting is that there's a lot of literature that's coming out now showing that skills that were the focus of a particular social communication intervention continue to progress as a child ages and develops, and so do related skills. So that's very exciting. We also know that the family seems to do better when children participate in high-quality early autism interventions. So the child's benefiting, the family's benefiting through these kinds of interventions, and there's some new research also coming out suggesting that society benefits. So really, by all accounts, autism is a very expensive developmental disability. So there is a recent report released that said that each year, the costs associated with autism are about $126 billion, which is huge and a really daunting figure, and reflects costs associated with education, healthcare, unemployment, underemployment, and with just the increasing prevalence and incidence of autism, you can only imagine how that large figure can just keep getting bigger. And there's research showing that if we do good, high-quality interventions that focus on social communication, kids just don't need the same kinds of treatments and interventions later on down the road. And so that ends up costing less money. So there's a lot of benefits and reasons why we really want to try and do interventions that focus in on social communication in young children. But unfortunately, we know that most children who are on the spectrum just don't participate in these really critical types of interventions. Really, the rate of service use for young children on the spectrum is about 1/10 of what is expected. And this type of problem is really intensified for children who come from underserved and underrepresented communities. So given the idea that these interventions are so critical for young children who are on the spectrum, and that we know a lot of kids who are on the spectrum just are not taking part in these interventions, what can we do to try and help the treatments become more commonplace? Well, the good thing is that this question is actually now starting to get answered. People are devoting a lot of attention towards it and drawing from existing implementation science. And as it regards young children who are on the spectrum, there's a lot of suggestions that intervention should happen in the preschool setting. So for young children on the autism spectrum, there seem to be certain reasons why the preschool setting is uniquely positioned to be able to really make meaningful growth in young children on the spectrum for this skill. So first off, as it regards young children on the spectrum benefiting from these kinds of interventions in the preschool setting, we know that a lot of children who are on the autism spectrum attend preschool at some point in their childhood. So the autism intervention field has often been described as very eclectic, so meaning that there's so many different types of services out there for families to choose from for their young children on the spectrum. There's so many places that intervention can happen, and a lot of times people just kind of pick and choose which intervention seems like it could be the most effective for a particular child. And despite this eclecticism, though, 73% of all children on the autism spectrum are reported to at some point in their childhood pass through the preschool system. So, you know, that's a really great opportunity to try and efficiently catch a lot of children in this one context. We also know a lot of children who are on the autism spectrum are served in the school setting. So by all accounts, just the number of children served under the autism label is getting larger and larger every year. In one recent report, when numbers were compared from the early 90s to the present, it was reported that there is an 800% increase. So there's just lots of children who actually are in these school contexts, so the school can just serve as a great way to catch a great number of children on the spectrum. And then we also know that right now in the school settings, there really are not a lot of practices that seem to be happening that are as optimal for promoting social communication. And we know this just based upon asking teachers, well, what are some strategies that you're using to try and promote language and play and social skills in children? And then also when researchers just go into the classroom and observe children and teachers and see what they're doing.
Oh, could I ask a question?
Yeah.
So you said there was an 800% increase in diagnosis in children with autism.
Not in diagnosis. That's a good question to clarify. For this particular study that I was referring to, it's actually in the number of kids served in the school setting. Yeah, and that particular study was based out of California and looking at just how kids are receiving services through the education system.
Okay. So not necessarily being specifically diagnosed, just the number of children being served.
Yeah, so there's always a lot of conversation about the differences between an educational label of autism versus a diagnosis of autism that might happen using research criteria or by seeing a psychologist. And sometimes when studies are done, you see differences between the figures in the school setting versus other places. But with having kids go through the school system and get an autism label, you know, that requires that they are entitled to receive certain kinds of services. And we know that each year pupils who are on the autism spectrum cost us about $17,000 per year, just with all the related services and some of the individualized supports we need. So, yeah, that's a great question. And another advantage of the preschool setting is this idea that the preschool setting can also just provide a sufficient amount of intervention. So we know with kids on the spectrum that simply enrolling them in a high-quality intervention isn't enough to try and induce important change. We have to make sure that kids are enrolled in treatment for the right amount of time. And so by virtue of the fact that preschools are in session for really a mandated amount of time every day, kids have to come every week for an entire year, there's the opportunity to really make sure that we're getting a sufficient amount of treatment. And some autism interventions are criticized because they are not thought to be as meaningful to children. So the idea that sometimes materials that are used or the people who are teaching the intervention or the way in which the treatment is being taught just isn't actually like what children encounter in their real world. So thoughts being that if an intervention's taking place in a school setting, that could just increase the ease with which we are trying to make an intervention as similar as possible to what's happening in the child's world. And programmed for generalization right from the get-go. So it's easy for children to understand how to use these skills in their life. So my presentation today is really focused on how to capitalize on this potential that the preschool system wields. So I want to start off by having a conversation about where we are as a research community in doing intervention studies on school-based social communication treatments, and then also talk about the promise that these interventions wield, as well as how to increase the momentum of these kinds of studies. So first off, to talk about where we are with these treatments. I'm going to briefly present to you the results of a systematic analysis that I did with some colleagues here at the university. And as a disclaimer, the systematic analysis is rather limited in scope, and it was just one part of a larger literature review we did. But our goal for this systematic analysis was to look at the most recent social communication intervention studies that have been done with children on the spectrum, and to see who was actually doing the treatment, where were the treatments implemented, and what was the quality of the intervention studies themselves. So we followed criteria that's pretty common for systematic analyses, look through specific databases, use specific search terms. We obtained a total of 74 articles, and then utilized inclusion and exclusion criteria that helped us hone in on those intervention studies that focused on really young children who are on the autism spectrum and social communication interventions. So we ended up only really being able to use a total of 21 studies, and the majority of these studies, interestingly, were group design studies. So then these studies were coded based upon where they were happening, who was doing the treatment, and what the quality of the treatment actually was. So pretty fast coding. The location could either be categorized as university clinic, home, or school. Implementer could be a university clinician, parent, or school professional. And for the school professional category, we were inclusive of aides and paraprofessionals, teachers, and other related school personnel who were actually working in a school setting. And then the quality could be categorized, the quality of the treatment could be categorized as established or emerging. And that was according to definitions that have been created regarding autism spectrum disorder treatments, so following the National Standards Project. So I'm going to show you a graph that shows you the number of intervention studies based upon location. And on the y-axis, just show you that'll show you the number of intervention studies, and then below here, the specific locations. So as you can see, looking here at this graph, most intervention studies in the past 5 years on this topic were conducted in the clinic. And there's actually a similar trend that is shown here in this next graph of the number of intervention studies based upon individual. Here you can see that, again, a lot of studies were implemented by clinicians, and also a decent number were implemented by parents. And remember, we just talked about how critical the preschool context is for interventions that focus on social communication, and that we know when we go into the classrooms, teachers and paraprofessionals, by and large, just aren't implementing strategies that effectively promote the social communication of children on the spectrum. But yet we as a research community, when you kind of look at these graphs, we're not doing a lot of studies in school settings and by actual real-world school providers. With respect to the quality of these social communication intervention studies, about half of them were categorized as established, half as emerging. And then by location, interestingly, about half of the studies that happened in the preschool context were categorized as established treatments, and half were categorized as emerging treatments. So by and large, this really brief systematic analysis suggests that as a research community, we're we're really not doing that many studies on these social communication interventions in the preschool context. And we're not doing them with the professionals who actually are out there every day trying to improve the social communication of children on the spectrum to the best of their abilities. And really when that's happening, the treatments themselves aren't of a particularly high quality. And you know, when we're not doing interventions out in the real world, and I know I'm only preaching to the choir here, we miss out on the opportunity to see if an intervention can survive when it's faced with a lot of really formidable real-world barriers. So, you know, it's kind of unfortunate to see that a lot of our social communication interventions for young children on the spectrum that are starting to come out now aren't focused on this really important context, a context a lot of researchers think treatment should happen in. So it seems like there's just this disconnect between the research lab and the classroom. But something positive to note is that when these intervention studies are happening, the results are pretty promising. This, you know, slowly emerging body of literature that's coming out suggests that it is possible to actually improve the social communication of children on the spectrum in the school setting. And this has been shown in a variety of different kinds of intervention formats. So in intervention formats where clinicians come in and they take a child and pull them out, do an intervention, and then the child comes back into the classroom. Also in treatments where a clinician comes into the classroom, does an intervention, and then leaves. And then also treatments where classroom practitioners are actually trying to embed the intervention throughout ongoing activities. And I'm gonna focus on that idea of classroom practitioners trying to embed interventions throughout ongoing activities, because we know in terms of sustainability and feasibility, the more we can have real-world providers actually implementing treatments, the more likely it is that we're going to be able to reach a lot of children in this really important context. So I want to present to you the results of a study that I did that's just this pilot randomized controlled trial. And the goal of this study was to try and have kids using more social communication skills, and specifically was interested in having the children use more social communication gestures to express interest. And so those are the kind of gestures that are very uniquely impaired in kids on the spectrum. And tried to have kids learn how to use more social communication by teaching teachers how to work with the children. And so a second aim was regarding teacher fidelity, interested in knowing whether or not the number of strategies that teachers acquired changed as a result of the treatment. So this group this study utilized a waitlist control design, and by looking at this table here, you can see that kids in both groups and teachers in both groups and then classrooms in both groups were pretty equal according to a range of demographic characteristics. Want to quickly go over the procedure with you. Of course, after children were consented, eligibility was determined, and one really important criteria was actually making sure that children were on the spectrum. So a series of assessments were done to confirm that children actually had an autism spectrum disorder diagnosis. And there were about 5 children who were excluded from the study at this phase because they just didn't meet research criteria for autism.
About your control group, are
Yeah.
these children, I'm just curious, are they going to school with typically developing peers, or are they in a school on their own?
Yeah, in this study, they were children who were in inclusive classrooms. Okay. Yeah, so it ended up being that usually there were about 1 or 2 children per classroom who were in this study, and then the rest of the kids were typically developing. Yeah, that's a great question. So first, the diagnosis of children was confirmed, and then entry data were collected. And The three main assessments that were administered included one play interaction where the child and the teacher were taped playing together with a standardized set of toys. Another was just observing the teacher and the child playing together in the classroom. And then another assessment was with the child and an experimenter, trying to see how many social communication skills the child used when they were with someone who didn't really know them. And all these assessments were administered by people who did not know the purposes of the study or what treatment groups the kids were in. And the coders also were the same. At exit to the study, there were some measures that were administered to try and get an understanding about the perception that teachers had with the intervention, but I'm not going to go into that. So just how feasible did the teachers actually think the treatment was. And then throughout all of these different assessments, the primary code constructs that were coded were social communication, so joint attention, and then also teacher fidelity. Children were then randomized to either the immediate treatment group or the delayed treatment group, and that was done by someone who wasn't associated with the research study. And then intervention started for the immediate treatment group, and then the kids who were in the delayed treatment group just continued to take part in their regularly occurring preschool activities. The kids who were in the immediate treatment group, they participated in an intervention that had previously been validated with university clinicians. And it was a treatment that had been shown to be very successful at improving the social communication of young children on the spectrum. But this treatment itself was simplified a little bit. So only the strategies that were believed to be the most powerful were taught to teachers. So it could be a little bit more easy to implement the treatment throughout classroom activities. And then the coaching protocol was based off of an established model for coaching. So the first graph that I'm going to show you about these results show the results of the child in the classroom setting. So in this graph here, the dashed line represents the children who are in the experimental intervention group, so the immediate treatment group, and then the solid line is for kids who are in the delayed treatment group. On the y-axis, you can just see the average joint attention frequency. So at entry, both groups of children produced about the same number of joint attention skills in their classroom setting. But at exit to the intervention, the group of kids who were in the experimental treatment produced significantly more joint attention skills in the classroom. And remember, this skill of joint attention was assessed in a lot of different ways. So it wasn't just the classroom, it was also a tape play interaction, also an assessment with a blinded observer. And I want to give you a sense of what it actually means that this skill improved in young children. So here is a video clip of one.
Animals?
So that isn't playing with the child moving, so let me just tell you about what happens. So just in this experiment, this clip, a child was using joint attention skills. So he was using the skill of a show and a point, which we talked about earlier as being really critical for young children on the spectrum. So it's very cool that he ended up being able to use such an important skill with someone who didn't teach him the intervention, and he used it with materials that weren't actually used when he was in the classroom. So another goal for this study was to look and see if teachers actually learned the experimental intervention. So teacher fidelity for this study was just operationalized as the number of strategies that teachers used. So that is on the y-axis. And at entry, just like the first graph I showed you, both groups were producing about the same number of intervention strategies at entry. But at exit to the intervention, the group of teachers who were in the experimental group ended up producing a lot more strategies. They used more strategies to facilitate the social communication of children on the spectrum. So in this clip, you'll see one teacher interacting with a child on the spectrum and really using some strategies that she was taught very well. Well, sorry. We did get the sound to work, so beforehand they were moving, but there wasn't any sound, so no worries. Just was an illustration to kind of show you one teacher doing a great job at implementing strategies with a child who started off being a little oppositional, not wanting to play, and just to see her finesse in trying to, in a non-pressuring way, play and interact with him. So this study just suggests it's actually possible to improve the social communication of children on the spectrum in the classroom context. Again, this study, like a lot of the other studies that are being done that are in the school setting and using real-world providers have methodological limitations that really need to be followed up with future studies, but just suggests it's possible to improve an important skill with children on the spectrum. But again, there aren't a lot of these studies that are out there right now in the research community, and we really know that a lot of practitioners aren't adopting that many strategies that successfully enhance the social communication of children on the spectrum. So what are some ways in which we can try and increase the momentum of this research? There are a lot of ideas that have come out about how to increase the feasibility and the sustainability as well as the dissemination of this body of research. By and large, sometimes these social communication interventions for children on the spectrum are just criticized for being too complicated and not that easy to implement in the real world. So there are ideas that just right from the get-go, these treatments should be tested out, programming for certain aspects of feasibility, certain aspects of sustainability. So I'm going to present to you the results of one study that attempted to do this and to program for feasibility and sustainability in really intentional ways. So first off, this particular treatment that I'll talk with you about that happens for young children on the spectrum, utilize this concept of active treatments, which is that the intervention itself only focused on teaching teachers the most powerful components of the intervention. So the intervention was a packaged, comprehensive treatment, and it was distilled down to just what were hypothesized to be the most powerful ingredients. And also the treatment manual itself was written in a way that it specifically talked about how to overcome some real-world barriers, and teachers, as they were trained, were talked about how to adjust to real-world challenges as they were interacting with children. So this intervention that I'm going to present to you was one where a teacher was teaching caregivers how to do this particular intervention to improve the social communication. So there is definitely the use of real-world providers. And it was an example of community-partnered participatory research, which is this idea that researchers and practitioners collaborate at every phase of a research project, or especially research intervention, to make sure that both groups are really benefiting from the research that's happening, and that when a research study is done, it can benefit the educational partners or the community partners who they're working with. So this study was conducted at a preschool that I direct over in the medical center, the Nysonger Center Early Childhood Education Program, and we've been able to utilize some of the lessons that we learned throughout this process in some of our home visiting work this past year. And then we also really systematically adjusted the treatment at various phases based upon teacher perception of how easy the intervention was to implement, as well as parent perception. So I want to talk to you just about this treatment study. The primary outcome for this study was just the number of spontaneous single words that the child produced, and was also interested in knowing about the number of gestures children use, so gestures to request or gestures to express interest. And we did look at parent fidelity, so seeing did parents end up using more skills that they were taught as a result of the treatment, but I'm not going to present that to you today. So this study, again, was just a feasibility trial, and it utilized a multiple baseline across participant design. And for that kind of design, there's just a fewer number of participants. So the participants that are listed here are the child and then the caregiver. And this study focused on toddlers who are on the autism spectrum. So you could see that really, if you just eyeball the table, the kids and the caregivers and the home environments were pretty similar across a lot of different demographic variables. So all the kids, and this is a limitation, were enrolled in the same classroom. And the person who implemented the treatment was the same teacher. This teacher had just been a teacher for 2 years, didn't have any specific training in autism spectrum disorder, but he was the one who was actually teaching the parents how to do the treatment. So very quickly, the procedure consisted of first training the teacher, and to do that, the teacher had a treatment manual, and the training period itself lasted about 2 months. And consisted of weekly home visits with the teacher, where the teacher had an opportunity to test out some of the intervention strategies with children who were not included in this study. And then participants were consented and eligibility was determined, and there were a lot of criteria that needed to be followed for kids to be able to, and parents and teachers, participate in the study. The primary entry assessment that I'll present today was just a taped play interaction of the child and the caregiver playing together. And this was taped in the home with toys in the child's home. And then the specific outcomes that were coded, and these were coded by people who didn't know the purposes of the study, or really when children were in different phases of the treatment. They coded the number of words that the child produced and then the number of gestures. So in single subject design research studies, there's always this phase called the baseline phase. And that's a period of time in the treatment where the intervention hasn't happened. So when the intervention wasn't happening, the teacher was told to not implement the treatment and instead follow a manualized home visiting protocol that was adopted by the preschool. And this is a very common home visiting protocol, one that's adopted in many states. It's called the Assessment, Evaluation, and Programming System. And during this phase, we checked to make sure that the content actually wasn't being implemented by the teacher unintentionally. And then the intervention itself, again, had those components we talked about that really systematically programmed for feasibility and sustainability. And so these graphs here show the results of the study. On the y-axis, you can see the number of occurrences as it regards spoken communication. And then time is just on the x-axis, so the number of sessions. So in a single subject design research, really generally speaking, you want to look for each dyad or group of participants, compare what's happening on this side, the baseline phase, to what's happening over here in the intervention phase. And for the first participants, you can see that the child wasn't producing very many vocalizations before the treatment started. And then afterwards, there were more vocalizations. There's some variability, but the average for this dyad was 7.5 vocalizations. And a similar pattern happened for the next dyad. Again, don't see very much communication happening here for the child. and then the intervention happens, and then there starts to be more growth. So here for this child, the average number of vocalizations was 29 per intervention session, which is a pretty sizable growth. And this final dyad ended up having growth as well. So if you compare what's happening with this child prior to the intervention and after, you can see some change. So this suggests that the intervention was successful at being able to increase the number of vocalizations in the child. So I don't think I can show you a clip of this. Let's see. All right, so we got one clip to work. So this is just a video clip of a caregiver playing with his child before the intervention started. And this is a toddler. He's playing with puzzles, which are a very common age-appropriate toy to play with this child, but you don't see him actually using the pieces appropriately, putting them where they're supposed to be. He doesn't really look like he's having fun. You're not hearing vocalizations besides some types of protests. And they're really not jointly engaging together. But I mean, the dad is really trying hard with a lot of strategies that are really well intended. So let's see the same dad and son after the intervention. First off, you see a different choice of activities. And the dad is just programming really intentionally for the child to say go. The two build a routine together. And you see the child spontaneously is saying go. This is a really simple type of routine for the dad and the child to be doing, but it's very motivating to the child. The child can be very independent in it. And you see he's having a lot of fun. It's very motivating. And you see the dad pausing, waiting for communication. So just a really nice example of how the dad was able to implement some of these strategies that can be kind of challenging. So this study suggests that it's possible to improve the social communication of toddlers who are on the spectrum by having teachers train caregivers. And again, I'm not presenting the results of whether or not caregivers actually also learn the strategies, but they were able to. And so this treatment suggests it's possible to have real-world providers implement the treatment, and by and large, the treatment just really didn't need that many resources. So in conclusion, today I just really want to impress upon you the idea that we know that interventions that focus on social communication are so important for young children on the spectrum. And we know that out in the real world, a lot of children who are on the autism spectrum just are not participating in these really, really important treatments. And in the research community right now, we're not doing as many interventions as really we could be that try and hone in on trying to improve such a critical impairment. So we've really only begun to scratch the surface kind of in our understanding of how to make change in such an important skill in the preschool setting. And there's a lot of exciting work that really still has to take place. So thank you very much for inviting me today.
There's about time for about 10 minutes of questions.
Mm-hmm. Yeah.
I feel like the question girl.
No, I'm so glad. They're very thoughtful.
This is not the time to talk about the specific interventions, because that's what I want to know. Well, what if you had to choose top 3 of your great interventions for working with children in this way, what would it be? But I won't ask that question. I'll email you. But I want to know, did you guys follow up long term with these kids to figure out what the long term effects were, or is this just sort of short-term and this is what was happening during the intervention? Because that's what I'm curious about.
Yeah, so with some of the studies that were presented, there was follow-up and then some there was not. So this last study with the teacher training the caregivers, there was a 1-month follow-up and the results did maintain at the 1-month follow-up. With the study that I presented before that of the preschool teachers, using the waitlist control design, we didn't do a follow-up, kind of with some of the challenges that are associated with just a waitlist control design in and of itself. In general, social communication interventions that are done with children on the spectrum, there have been some really impressive long-term follow-up studies. There was one recently published of kids who had participated in the intervention when they were preschoolers and then followed up when they were 12 years of age, and the growth just kept happening, which was very exciting to see.
Thank you.
Yeah, good question.
So when you were looking at the students in the classroom where the teacher did the intervention, did you do any comparisons to what their peers who were not on the autism spectrum disorder were producing? Because I know you said there was an increase in production by the end of, but how did that relate to their peers? Did you do any of that comparison?
Yeah, so to be really honest, it was an unfunded investigation, and we started off doing that, and we just couldn't continue because of not having enough resources. So we started off, being really ambitious, also coding what other children in the classroom were doing, but couldn't continue that. So I think that's a really important thing to bring up. You want to always make sure that the child who you're focused in on improving social communication is kind of improving relative to what some of those other children who are in the classroom are doing. But for the studies I presented, we didn't do that. So what I'll say, though, is for some of those semi-standardized assessments, those have been done with a lot of kids who are typically developing and then a lot of kids who have developmental delays. So while the specifics, so they're not normed and standardized, but it's a little bit easier to kind of compare the performance of a child on the spectrum to what you'd expect to another child.
You may have said this already.
Yeah.
But I can't remember. How much time was spent with, you said there was like a 2-month training period for the teacher. Then how much time was spent with the teacher and the parent training?
Yeah, because it was a single subject design, it kind of varied with how long the treatment lasted. So with one diet, it lasted just 4 weeks. And you could hypothesize about some reasons why that diet in particular might have been able to get the treatment a little bit more quickly. And then with another diet, it lasted as long as 14 weeks. So with a single subject design, the thing that's kind of nice, especially as we were testing out this protocol, is that you can really individualize it. So the treatment could last a little bit longer. It took a while for some dyads to be able to respond to the treatment. The first study that was presented, the treatment itself lasted 6 weeks for all dyads. And actually in both studies, there was always just 1 hour weekly of coaching. Do you have a question?
You answered it.
Perfect. Any other questions? All right, well, thank you so much for this opportunity. Really appreciate it.